This is All India Radio. We now bring you a special news program on COVID-19. Good morning, I'm Sunil Verma, and with me is Vaibhav Srivastava. The headlines. Prime Minister Narendra Modi says the entire nation is united in fight against coronavirus. Government exempts shops of agricultural machinery, tea industry and related services from the lockdown. Bihar government decides to screen 180,000 people again for COVID-19 infection. India's foreign exchange reserves rise by $5.65 billion after falling for 2 weeks. And FIFA Under-17 Women's World Cup, scheduled in November, postponed. Prime Minister Narendra Modi has said the nation is united in the fight against COVID-19. The Prime Minister said people are at home during lockdown, but they're not alone, as collective strength of the entire country is with each one of them. In a video message yesterday, he urged the countrymen to switch off lights of their homes on Sunday at 9 p.m. for 9 minutes and light up diyas, candles or mobile flashlights to display the nation's collective spirit to defeat coronavirus. The Prime Minister said the country has to move towards light from the darkness created by coronavirus.
5 अप्रैल को रविवार को रात 9 बजे घर की सभी लाइटें बंद करके घर के दरवाजे पर या बालकनी में खड़े रहकर 9 मिनट के लिए मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट जलाएं और उस समय यदि घर की सभी लाइटें बंद करेंगे, चारों तरफ जब हर व्यक्ति एक एक दिया जलाएगा, तब प्रकाश की उस महाशक्ति का एहसास होगा जिसमें एक ही मकसद से हम सब लड़ रहे हैं, ये उजागर होगा.
The Prime Minister said people should maintain social distancing, stay indoors and not form groups while lighting up the lamps. He said people displayed unprecedented discipline and sense of service during the ongoing nationwide coronavirus lockdown. The Prime Minister also said the way people paid gratitude to those fighting against COVID-19 on 22nd of last month has become a model that is being emulated by other countries.
आपने जिस प्रकार 22 मार्च रविवार के दिन कोरोना के खिलाफ लड़ाई लड़ने वाले हर किसी का धन्यवाद किया, वो आज सभी देशों के लिए एक मिसाल बन गया. आज कई देश इसको दोहरा रहे हैं. जनता कर्फ्यू हो, घंटी बजाने, थाली बजाने का कार्यक्रम हो, इन्होंने इस चुनौतीपूर्ण समय में देश को इसकी सामूहिक शक्ति का एहसास कराया. यह भाव प्रकट हुआ कि देश एक होकर कोरोना के खिलाफ लड़ाई लड़ सकता है.
Nationalist Congress Party MLA Rohit Pawar has welcomed Prime Minister Narendra Modi's appeal to citizens to light a lamp this Sunday. In a tweet, Pawar has said everyone should welcome the thought as the Prime Minister is aiming to bring the country together. Bollywood too has endorsed the idea and urged people to wholeheartedly carry out the task as one unit. Bollywood stars like Arjun Kapoor, Bhumi Pednekar and veteran actor Hema Malini took to Twitter to support the initiative, asking fans to stand united in this fight against COVID-19. Prime Minister Narendra Modi had a telephonic conversation with Prime Minister of Israel Benjamin Netanyahu yesterday. The two leaders discussed the ongoing COVID-19 pandemic and the response strategies adopted by their respective governments to the health crisis. The leaders explored possible collaboration between India and Israel in fighting the pandemic. It includes improving the availability of pharmaceutical supplies and innovative use of advanced technologies. They agreed to maintain a focused channel of communication to explore such synergies. Mr. Netanyahu agreed with Prime Minister Modi that the COVID-19 pandemic is an important turning point in modern history. It offers an opportunity to forge a new vision of globalization focused on the shared interests of humanity as a whole. The government has blacklisted 960 foreigners who participated in the Tablighi Jamaat in Nizamuddin Markaz in New Delhi. Briefing media yesterday, the Joint Secretary in Ministry of Home Affairs, Punya Salila Srivastava, said strict action will be taken against them under the provisions of Disaster Management Act and Foreigners Act. She said deportation of these people will be made
following the standard protocols. She said blacklisting process has been started against those 360 people who participated in the Tablighi Jamaat and returned to their countries. Ms. Srivastava said that all the DGPs and police commissioners have been told to take strict action against the visa violators under the Disaster Management Act and Foreigners Act. She informed that 2 new helpline numbers have been added in addition to 7 helplines. She said the 2 new helpline numbers are 1930, which is an all India toll-free number, and 1944, which is launched for the northeastern people. Ms. Srivastava said that the centre has asked the states to provide security to the healthcare professionals.
कुछ स्थानों पर हेल्थ केयर प्रोफेशनल्स और फ्रंटलाइन वर्कर्स की सिक्योरिटी से संबंधित इंसिडेंट्स हुए हैं। इस संदर्भ में एमएचए ने राज्य सरकारों को पत्र द्वारा और मीटिंग्स में कहा है कि स्ट्रिक्ट एक्शन ले और हमारी जो मेडिकल फ्रैटर्निटी है उसकी सुरक्षा सुनिश्चित करें।
The Health and Family Welfare Ministry has urged all the citizens to download Arogya Setu app, as they will enable people to assess themselves of the risk for catching coronavirus infection. This was stated by Joint Secretary Love Agrawal yesterday.
एक नई एप्लीकेशन आरोग्य सेतु भी कल लॉन्च की थी। इस ऐप के द्वारा आप अपना रिस्क असेसमेंट कर सकते हैं। साथ ही अगर कभी भी आप किसी कोरोना पॉजिटिव पेशेंट के संपर्क में आते तो इस ऐप के द्वारा आपको नोटिफिकेशन मिल सकता है। मैं सबको सूचित करना चाहूंगा कि अब तक 30 लाख लोगों ने इस ऐप को डाउनलोड कर लिया है। यह ऐप हमारी एंड्रॉयड यूजर्स के लिए प्ले स्टोर पर और iOS यूजर्स के लिए एप्पल प्ले स्टोर पर उपलब्ध है।
Mr. Agrawal said Agriculture Ministry is promoting the e-NAM portal so that farmers can sell their products online to ensure social distancing. He said, as of now, 585 mandis are linked with e-NAM and work is in progress to add 415 mandis in future. Dr. Manoj from the Indian Council of Medical Research has said that 182 laboratories have been given approval so far to conduct the coronavirus testing. He said out of these, 130 are government laboratories and 52 are private laboratories chains.
In the wake of the coronavirus outbreak, the Union Health Ministry has placed an order of about 10 crore hydroxychloroquine tablets from various pharmaceutical companies for healthcare workers. The Indian Council of Medical Research, ICMR, has suggested the use of hydroxychloroquine tablets only for healthcare workers and caregivers involved in the treatment and direct contact with the suspected or confirmed COVID-19 patients. For those COVID-19 patients who require intensive care unit care, the Health Ministry has suggested the use of hydroxychloroquine tablets in combination with azithromycin. The Health Ministry has said that the number of COVID-19 cases climbed to 2,547 in the country so far, while the death toll rose to 62. It said the number of active COVID-19 cases stands at 2,322, while 162 people were either cured or discharged and 1 had migrated.
In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Nandakumar, Professor of Psychiatry, AIIMS, suggested that people should stay at home, spend time with family members and practice yoga.
We are going to overcome this crisis within a few weeks. In the coming few weeks, stay at home, spend time with the family, do household work, exercise, listen to music, sing with the family, do yoga, meditation and take care of emotional need of the family and yourself.
Dr. Anvita Agrawal, resident physician, infectious diseases, AIIMS, advised the people not to be negligent and stay at their homes.
Coronavirus may be invisible, but the number of people affected are very much visible. More than 4 lakh people have already been affected all over the world, and the numbers are increasing from day to day. Don't be negligent. Please stay at home.
For listening to other experts, tune in to our next bulletin. The Ministry of Home Affairs, MHA, has issued the 4th addendum to the guidelines issued regarding lockdown to fight COVID-19. It exempts shops of agricultural machinery and its spare parts. The 4th addendum, issued by Union Home Secretary Ajay Bhalla yesterday, also exempted shops for truck repairs on highways, preferably at fuel pumps. Tea industry, including plantations with maximum 50% workers, has also been exempted. The MHA said that social distancing and proper hygiene practices must be ensured in each of these activities.
Home Minister Amit Shah has approved the release of 11,092 crore rupees under the State Disaster Risk Management Fund SDRMF to all the states. Prime Minister Narendra Modi, during his video conference meeting with the Chief Ministers on Thursday, had assured them about it. The centre has released in advance its share of the first instalment of State Disaster Risk Management Fund for the year 2020-21 with a view to augment funds available with the state governments. With a view to make available additional funds to the state governments for taking preventive and mitigation measures for containment of COVID-19, the centre on 14th of March has already made a special dispensation for the utilisation of State Disaster Response Fund SDRF. The Finance Ministry has released 17,287 crore rupees to different states to enhance their financial resources during the COVID-19 crisis. This includes 6,195 crore rupees on account of revenue deficit grant under the 15th Finance Commission recommendations to 14 states.
After falling for 2 weeks in a row, India's foreign exchange reserves have surged by $5.65 billion to $475.56 billion in the week ended 27th of March. A Reserve Bank of India press release informed that foreign currency assets, a major part of the overall reserves, increased by $2.56 billion to $439.66 billion. In the previous week, the reserves had declined by $11.98 billion to $469.91 billion. This happened as RBI was supplying dollars to contain fall in the rupee, which has breached the 76 mark against the US dollar. Gold reserves also increased by $3.03 billion to $30.89 billion. India's special drawing rights with the International Monetary Fund went up by $14 million to $1.42 billion. The country's reserve position also increased by $44 million to $3.58 billion.
This is All India Radio giving you a special program on COVID-19. Let's take a look at the headlines once again. Prime Minister Narendra Modi says the entire nation is united in fight against the coronavirus. Government exempts shops of agricultural machinery, tea industry and related services from the lockdown. Bihar government decides to screen 180,000 people again for COVID-19 infection. India's foreign exchange reserves rise by $5.65 billion after falling for 2 weeks. And FIFA Under-17 Women's World Cup, scheduled in November, postponed. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts. The centre is taking several measures to ensure smooth harvesting of Rabi crop and sowing of the summer crop. Department of Agriculture Cooperation and Farmers Welfare conducted a video conference with all the states and insurance companies to review the payment of claims, status of conduct of crop cutting experiments CCEs for Rabi crops, crop loss surveys and implementation of smart sampling technique, ensuring that the farmers do not suffer from any adverse fallout during the lockdown period. For facilitating farm insurance, letters have been issued to all the states to issue passes to representatives of concerned insurance companies for co-witnessing crop-cutting experiments and to relax the norms for conducting field-level survey for intimation received for post-harvest crop losses due to non-seasonal rainfall and hailstorm. In the lockdown period, Kisan call centres at all 21 locations are being operated by diverting calls to individual mobile numbers of farm tele-advisors who are now operating from homes. All 454 KCC seats are being operated daily between 6 a.m. to 10 p.m. Call flow is about 15,000 to 20,000 per day. India will participate in the WHO's multi-country solidarity trial for developing potential treatments and drugs for COVID-19. This was informed by the Indian Council of Medical Research ICMR yesterday. In India, the trial will be coordinated by scientists at ICMR National AIDS Research Institute, Pune. The ICMR is also working with the Department of Biotechnology, Department of Science and Technology and Council of Scientific and Industrial Research CSIR to develop a vaccine for COVID-19 and the diagnostic kits. As the country is fighting against COVID-19, the entire machinery of Ministry of Petroleum and Natural Gas is working for smooth delivery of cooking gas to the citizens. A report from our correspondent.
Over 8 crore Pradhan Mantri Ujjwala Yojana beneficiaries will be given PG cylinders free between April to June. 15 port terminals, 195 LPG bottling plants and transportation network are currently operating every day despite lockdown and ensuring uninterrupted supplies of LPG in the country. Delivery boys and oil marketing company officials are doing commendable work in ensuring uninterrupted LPG supplies to all households. More than 60 lakh cylinders are being delivered every day. Petroleum and Natural Gas Ministry has advised officials to ensure that the delivery boys take all necessary health precautions. The announcement of the special ex gratia of 5 lakh rupees for LPG delivery boys and others involved in the supply chain has boosted the morale of the staff. With Dipendra Kumar, Anupam Mishra, AR News, Delhi.
Associations representing officers of Central Civil Services, including the Indian Administrative Service, IAS, and the Indian Police Service, IPS, have formed an initiative called Karuna. An official informed yesterday that it aims to support and supplement the government's efforts in fighting the pandemic. The acronym Karuna stands for Civil Services Associations Reach to support in natural disasters. It represents a collaborative platform on which civil servants, industry leaders, NGO professionals and IT professionals, among others, have come together to contribute their time and abilities.
The Election Commission has further deferred Rajya Sabha polls in view of COVID-19 pandemic. Fresh date for the polls will be announced later. The biennial elections were to be conducted for 18 seats from the states of Andhra Pradesh, Gujarat, Jharkhand, Madhya Pradesh, Manipur, Meghalaya and Rajasthan on 26th of March, but they were deferred on 24th of last month due to COVID-19. A Mumbai court yesterday rejected Yes Bank founder Rana Kapoor's interim bail plea. Kapoor had sought bail on the ground that his prevailing medical condition puts him at the risk of contracting coronavirus infection in jail. He claimed to be suffering from chronic immunodeficiency syndrome, which causes recurrent lung, sinus and skin infections, besides hypertension, anxiety and depression since the last 18 months. Kapoor was arrested by the Enforcement Directorate under the Prevention of Money Laundering Act.
Bihar government has taken the decision to undertake screening of over 180,000 people again who had come from outside after 22nd of March. A report.
During the first phase of screening, people who had come to Bihar from Maharashtra, Kerala, Tamil Nadu and Delhi will be screened. Screening of people will be completed within 6 days. The district magistrates have been instructed in this regard. Over 27,000 migrant labourers have been kept in home quarantine for 14 days. 3,200 quarantine centres have been made near their villages. They will be kept in isolation wards if situation worsens. Activities of migrant labourers are being monitored to contain coronavirus infection. With KK Lal's report, Tanvi Khurana, AIR News.
In Madhya Pradesh, even though the incident of misbehaving with medical staff has tarnished the image of Indore, the cleanest city in India, the people at large are appreciating the facilities being provided in the quarantine centre. The number of corona-infected patients has increased to 154 in Madhya Pradesh. Indore has 112, the highest number of patients. So far, 8 people have died due to corona infection in the states. At the same time, patients recovering from corona infection are also encouraging the common people. A report.
The people of the Muslim community in Indore, the worst affected by the corona infection in the state, have described the facilities being provided at the quarantine center as better than home. They appeal to the corona suspected persons to come to quarantine center for treatment. Shabbir Hussain Rangwala, who has fully recovered after the corona infection, says that isolation is the best treatment for corona.
हॉस्पिटल में हूँ, मेरा संदेश है ये सारी जनता के लिए कि कोरोना से डरने की कोई आवश्यकता नहीं है। सतर्कता सबसे बड़ी चीज है, उसको संभालना है, सोशल डिस्टेंसिंग बना के रखनी है।
Earlier, the Shahar Qazis of Indore and Bhopal have also appealed to the people of the community to follow the government rules and fully cooperate during medical examination. Sanjeev Sharma, AIA News, Bhopal.
In Maharashtra, a total number of coronavirus cases has surged to 490, with 67 new cases reported yesterday. The State Public Health Department has informed that 6 people have died due to the disease during the past 24 hours, taking the total toll to 26. Mumbai continues to be the hotbed with 53 of these new cases reported from the Mumbai metropolitan region. This figure includes 11 Central Industrial Security Force CISF personnel based at Kharghar. It is suspected that they caught the infection while on duty at the Mumbai International Airport. More than 100 other officers stationed at the facility have been tested and have been advised home isolation. An employee of Brihan Mumbai Electric Supply and Transport was also found to be coronavirus positive. The Best administration has said that it has shut the transport training centre at Vadala, where the employee had last reported. The building will now be sanitized while its staff members have been asked to remain home quarantined. All the agencies, including Brihan Mumbai Municipal Corporation, are stepping up their efforts to fight the global pandemic. The Taj Group has offered its service for the doctors fighting COVID-19 in Mumbai. The Maharashtra government is also taking all necessary measures to help the poor and needy people in the state. More from our correspondent.
The Brihan Mumbai Municipal Corporation declared 5 hospitals as dedicated facilities for treatment of COVID-19 patients and another 6 as isolation centers yesterday. The BMC has also created isolation centers to admit the patients below 60 years of age and asymptomatic patients. Central Railway is also busy in converting the ICF coaches into isolation wards. Meanwhile, Food and Civil Supplies Minister of Maharashtra Chhagan Bhujbal has said that the state government has distributed around 6.94 lakh quintals of food grains to 28.61 lakh ration card holders. He said some 1.67 lakh card holders who migrated but are stuck in parts of the state due to the lockdown have also got food grains through the state online portability system. Shailesh Patil, AIR News, Mumbai.
In Gujarat, 2 persons died due to COVID-19 yesterday, including 1 each in Vadodara and Ahmedabad. The total number of deaths in the state due to coronavirus infection has now reached 10. The State Health Department said 95 cases had been confirmed in the state so far. In Haryana, a total of 44 confirmed cases of COVID-19 have been reported so far, which include 14 people who were cured and discharged from hospitals. The total number of active positive cases in the state is 30. 383 persons have been hospitalized in the state, and report of 343 persons is awaited.
In Himachal Pradesh, the state government would involve Panchayat Raj institutions and urban local bodies to identify those persons who have a travelling history from outside the state in order to fight against COVID-19. A report.
8,000 teams have been working under active case finding campaign and gathering information regarding people having symptoms of COVID-19. Chief Minister Jairam Thakur directed the officers to ensure that ACF teams had been provided safety equipment, masks and gloves so that they could perform their duties efficiently and without any fear. Meanwhile, all concerned officers of Himachal Pradesh have been directed to keep close watch on persons of Nizamuddin Tablighi Jamaat. It may be recalled that so far 296 persons had been investigated in the state for coronavirus. Of them, 6 cases have been found positive. Sanjeev Sundariyal, AIR News, Shimla.
Karnataka Chief Minister B.S. Yediyurappa congratulated the COVID-19 frontline warriors yesterday for their outstanding work in containing the coronavirus pandemic in the state. He informed that safety of health workers is of utmost importance and state government has ordered 3 lakh personal protection equipment. Karnataka Primary and Secondary Education Minister Suresh Kumar has informed that 288 people who returned after attending Tablighi Jamaat in Delhi have been identified till now. Of them, 187 were found negative of corona infection, 13 are positive, and 88 test results are awaited. More from our correspondent.
The state government has set up a committee to coordinate with industry, corporate sector, NGOs and civil society for seeking any assistance from them towards combating COVID-19. In an effort to help citizens staying at home during lockdown, Bengaluru South Member of Parliament Tejasvi Surya and other BJP legislators have started a helpline for residents to order any essential commodities. The items will reach the homes of such people. Sudhindra, AIR News, Bengaluru.
In Telangana, 75 new cases tested positive for coronavirus yesterday. It was the highest number of reported positive cases in a single day till now. With this, the total COVID-19 cases in the state rose to 229. The state government has informed that all people who attended Tablighi event in Delhi and their family members with corona suspected symptoms have been identified. More from our correspondent.
The entire focus of the state authorities is presently on identifying people with COVID-19 symptoms. Special teams of police and health workers initiated a massive lookout for identifying contacts following death of a 50-year-old woman who was tested positive for coronavirus after death. She had no travel history and possible contact with those who travelled. Now the medical tests are being done to the 4 tenants in her house and travelled in train from Delhi. The special teams have fanned out in Shadnagar of Rangareddy district and neighbouring Mahbubnagar district to rule out possibility of community transmission. No case of community transmission came to light in Telangana state. Lakshmi, AR News, Hyderabad.
Andhra Pradesh has reported its first death of a 55-year-old man due to COVID-19. His samples tested positive. It was the first death of a corona patient in the state after the first case was reported on the 12th of March. According to the health bulletin, this deceased son had returned to Vijayawada from New Delhi after attending the religious congregation at Markaz Nizamuddin.
In the country's COVID-19 patients chart, Tamil Nadu tops with 411 cases as 102 people tested positive last evening. 7 of them have been discharged after cure and the remaining are stable, as said by the State Health Department. Among all districts in the state, Chennai has the maximum caseload with 81 patients, followed by Dindigul district with about half the number. Chief Minister Edappadi Palaniswamy has warned that those who defy the lockdown norms will be subjected to stringent actions. More from our correspondent.
Reducing human interactions with COVID-19 patients and nourishing them with nutritious food is an important strategy in the disease management. Robots proved to be of immense help in routine work. The Tamil Nadu Health Minister Dr. C. Vijay Bhaskar inaugurated 3 such robots at the Stanley Medical College Hospital in Chennai yesterday. They are being operated by trained nurses. He said 5 more such robots will be put to use in Trichy shortly. Donations received from philanthropists for the Chief Minister's Relief Fund has crossed 62.3 crore rupees within days of the government making an appeal. Jai Singh, AR News, Chennai.
In Meghalaya, the state government has taken measures to ensure preparedness for any eventuality, including preparing for surge capacity, even as it is working on a 3-pronged preemptive strategy. The state is now equipped with 293 beds in the corona centres at Shillong and Thura, with a total number of 458 isolation beds in 70 hospitals across the state, which can admit COVID-19 patients. Civil Hospital, Shillong and Thura Civil Hospital have been notified as dedicated hospitals for focused treatment of persons infected with the highly contagious COVID-19.
The FIFA Under-17 Women's World Cup, which was scheduled to be played in India between November 2nd and 21st, has been postponed due to the pandemic. In a statement, FIFA said the new dates for the tournament will be identified later. The decision was taken by the FIFA Confederation's working group in its first meeting held yesterday. The working group also postponed FIFA Under-20 Women's World Cup, which was scheduled between August and September in Panama and Costa Rica. The working group has been recently established by the FIFA Council to address the consequences of the COVID-19 pandemic. Under-17 Women's World Cup was scheduled to be played in India across 5 host cities: Navi Mumbai, Guwahati, Ahmedabad, Kolkata and Bhubaneswar.
And now an overview of today's newspapers covering COVID-19 stories. The Prime Minister's message to switch off lights and light diyas at 9 p.m. on Sunday is carried on the front pages of most dailies. In a box item, the Pioneer writes that opposition leaders have criticized the Prime Minister's speech, saying they expected him to announce a second financial package. BJP chief J.P. Nadda is quoted in the Times of India as saying that the opposition is displaying their ideological bankruptcy. India's cases hit 3,000. 2 die in Delhi is the top story in the Hindustan Times. The Indian Express headline states Tablighi's spread grows larger. 647 cases across 14 states. A news item in the Pioneer reveals that nearly 9,000 people who attended the congregation have been traced across 14 states in India. And finally, Hindustan Times quotes Central Pollution Control Board data that proves that the lockdown has left the Ganga cleaner.
And now, before we end the special news program on COVID-19, the headlines once again. Prime Minister Narendra Modi says the entire nation is united in the fight against coronavirus. Government exempts shops of agricultural machinery, tea industry and related services from the lockdown. Bihar government decides to screen 180,000 people again for COVID-19 infection. India's foreign exchange reserves rise by $5.65 billion after falling for 2 weeks. And FIFA Under-17 Women's World Cup, scheduled in November, postponed. For details of these stories and more, log on to our website, newsonair.com and News on Air app. And with that, we end the special news program on COVID-19.